Now at 4, your community focus. We're talking COVID-19 today with Dr. Jim McDonald from the Rhode Island Department of Health.
He joins us right here every week on 12 News Now at 4 and joins us now live. Dr. M, thanks so much for being with us.
Oh, thank you for having me. And you can see I'm outside today because it is that nice a day that I wanted to spend some time outside with you guys today.
I love it. Wish we could be outside as well. Yeah. Dr. M, I want to start with some big news on the vaccine front that we got just in the last couple of hours. Expanded eligibility. So as of tomorrow, Rhode Islanders 60 to 64 and those under 65 with underlying health conditions can now get the vaccine in Rhode Island. I've already gotten a lot of questions on Twitter about, when those appointments are going to be opening up, if people have to provide proof of an underlying health condition. So what do people who fall into those groups need to know?
Yeah, very exciting news. So it is people 16 to 64 with underlying health conditions and our 60 to 64 group. Now, for people with those underlying health conditions, we're targeting the highest risk people so far who are ending up in the hospitals. When we looked at our Rhode Island data, people are most likely to end up in the hospital. People had heart disease, not high blood pressure, but heart disease. Those with certain lung diseases like emphysema, not asthma, but some lung disease where you can't breathe well, but kidney disease, the people with kidney disease, really higher risk, and then folks with a weakened immune system. Now, we have the conditions on our website, but quite frankly, you don't need to prove it. In other words, it's a self-attestation model, the honor system. And I know it sounds like, why are we doing the honor system? But that's what a lot of other states have done. I mean, quite frankly, I think you have to think about this from the social contract standpoint, folks. We're all in this together, right? If you're not one of those people in that high-risk group, are you really want to get in front of somebody else who is high risk? Because that's just kind of not the way we think in Rhode Island. So this is one of those things where I'm excited about tomorrow. It's a big change for us. It's a big group of people, though. It's probably almost 200,000 people in this group. But I think we can get through this group at least one dose in about 4 weeks or so. That's what I'm hoping for, at least. We'll see.
That is good news indeed, Dr. M. And just one additional question on that front. When can people in those groups start signing up? Is it 9 a.m. tomorrow, 5 p.m. tomorrow? What time?
Yeah. So you can go to vaccinateri.org, and it's 5 p.m. tomorrow. So don't get on there tomorrow morning. You'll be frustrated. But 5 p.m. for our state website. Now, CVS and Walgreens are expected to go live with that at 11 a.m. tomorrow is what we're expecting as well. And so I would just say, look, it's great news. We're excited about it, but I think the excitement's about it starts tomorrow, but wait till 5 o'clock at night. And then appointments open up again Tuesday at 9 a.m. So in other words, we have openings for appointments Fridays at 5 and Tuesdays at 9 a.m.
Dr. M, let's talk about side effects for a moment. We've heard from some people who said they had kind of flu-like reaction after getting the second shot. Anecdotally, we're hearing that younger people are having a more severe reaction than older people when they get the second shot. Are you hearing that? Any reason for the difference?
Yeah, we do hear that. And it kind of makes sense, doesn't it? Because when we're older, you don't have as profound an immune response. And it's funny, we're still calling them side effects, but it's really an immune response. And when you're older, like my mom and dad, 85 and 90, they got a sore arm. They were fine after the second shot. But the younger people, they have a more profound immune response. And so that's something we see. And I think it just speaks to your immune system kind of working through it all. That's all. Not to be surprised, nothing to be worried about.
And are you hearing anything about those, I want to use the right term, immune responses? Is that right? To the Johnson & Johnson shot?
Yeah, it's your immune response. The Johnson & Johnson has that immune response, but not as much as the Moderna or the Pfizer ones. We're not seeing as much an effect in that regard.
Okay.
Dr. M, I saw a remarkable headline, I believe it was just last week, about the fact that this flu season there has only been one child who's died in the U.S. from the flu versus the previous flu season where we saw, I think, close to 200 children die. Why are we seeing this drastic decline, and what lessons can we take away from what we've learned?
Yeah, this is part of the great news of the pandemic. In Rhode Island so far, we've had 0 deaths. Count that. No deaths in Rhode Island, maybe just a couple people in the hospital. And this is great news. Part of it's because of the flu vaccine, but really the big story is the flu never came to the Northern Hemisphere. In other words, we just aren't seeing the cases. And because people are walking around wearing their masks, I keep mine on me all the time, and because people are staying 6 feet apart, we're really finding we're not seeing as much flu. Because it's interesting, the last 2 weeks, what I normally be on the news talking about is, hey, folks, get the flu vaccine, because we're seeing flu, it's the peak. I'm looking at, we have less cases this year than we've ever had, and it's going down. So it's really great news.
Dr. McDonald, as always, we appreciate you joining us, and it's nice to see you outside. Hopefully we'll have nicer days ahead as well.
I hope you guys have a good rest of your day. I got some more work to do. Got some email to check out here, so thank you. Have fun.
You bet. Take care.